Ready to talk about prescription digital therapeutics? Dig into how apps may have a huge impact on mental health treatment? Or maybe you're confused about how something like this even works. Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. So, what's a prescription digital therapeutic, or PDT? Think of it as an app that doesn't just track your steps or remind you to take deep breaths, but a real treatment prescribed by a doctor and rigorously tested, just like medication. PDTs are designed to help with specific conditions like insomnia, ADHD, or even substance use disorders. That's pretty cool, right? So let's take Mia, for example. She's a mom of two and a full-time graphic designer. She's been struggling with insomnia for months and needs a solution that fits her super busy schedule. Her psychiatrist prescribes Somryst, which helps address her sleep patterns through CBTI. By tracking her sleep data in the app, Mia is able to make gradual adjustments that lead to big improvements. And Somryst is just one example of a PDT which delivers cognitive behavioral therapy through an app. Another PDT is EndeavorRX, a video game that helps improve attention in kids with ADHD. These aren't wellness apps. They are FDA-approved treatments. You need a prescription to use them, and some are even covered by Medicare or private insurance. Now, I know some of my therapist colleagues out there may have some concerns. Apps as therapy, but PDTs aren't here to replace you. They're tools that can complement your work. Imagine a client who struggles with insomnia but can't commit to weekly CBTI sessions. You could recommend Somryst to give them structured, evidence-based support between sessions. Or what if you're working with a kid who needs help staying focused? EndeavorRX might be just the boost they need. And let's talk about accountability, a huge benefit of PDTs. These apps track progress, provide data on usage and symptom changes, and make it easier to see what's working. For Mia, her psychiatrist could see her sleep efficiency jump from 65% to over 90%, and then adjust treatment based on her progress. This kind of real-time feedback is super helpful for collaborative care. And for therapists who feel stretched thin, PDTs could even help manage wait lists or help address symptoms or conditions that aren't in your area of expertise. It's all about collaboration. PDTs are something that are brand new to me. I've never prescribed one, and I haven't had a patient who's used them yet. But the research is really interesting, and it's hard not to get excited about the potential. Anything that helps people access high-quality, evidence-based care is a win in my book. There are so many people who can't make traditional therapy work in their lives, and this might be part of the answer. And as of January 1, 2025, Medicare began providing reimbursement for certain PDTs. Of course, there will be hiccups like with anything new, including access, cost, tech issues, skepticism. But I really think it's worth exploring, even if it could help just a handful of people. For Mia, the ability to track her own progress and share it with her psychiatrist gave her a sense of control over her treatment. So let's find out a little more about Mia. She's been battling insomnia for months, struggling to fall asleep, waking up multiple times at night, and barely functioning during the day. Therapy isn't an option right now because her schedule is packed and the cost is a barrier. Enter Somryst. Her psychiatrist prescribes this app, which guides her through the structured CBTI program, focusing on techniques like sleep restriction and cognitive restructuring. In the first week, Mia logs her sleep patterns and learns about habits that sabotage her rest, like lying in bed awake for hours. By the second week, she's adjusting her bedtime to match her actual sleep duration, even though it feels really counterintuitive. By week 6, she's consistently falling asleep within 20 minutes and waking up feeling refreshed. Her progress is logged in the app, and her psychiatrist can see her sleep efficiency jump from 65% to over 90%. And it says she feels more confident about managing her sleep long term because she can see the data, proving she's making progress. In fact, research has shown that Somryst can perform as well as face-to-face CBTI and even outperforms medications for chronic insomnia in some areas. For patients like Mia, that means access to treatment that is not only convenient, but also as effective or more than traditional options, with better long-term results. Another exciting area where PDTs are showing promise is in treating opioid use disorder. In a retrospective study, researchers evaluated the impact of the PDT Reset-O on use of healthcare service and medication adherence for 901 patients using the PDT Reset-O versus 978 controls under standard clinical care. The results were impressive. Use of Reset-O was associated with significant reductions in hospital encounters, inpatient stays, emergency department visits, ICU stays, and hospital readmissions. Even more compelling, patients using Reset-O demonstrated higher adherence to buprenorphine, a key medication for OUD treatment. And actual engagement with the app during a 12-week study found that 66% of the patients treated with Reset-O completed at least half of all core treatment modules, and 74% were still engaging in PDT treatment during the last 4 weeks of their prescription. This level of engagement is encouraging and shows how PDTs can keep patients actively involved in their recovery. So what's the takeaway here? Prescription digital therapeutics are an interesting emerging option that could change how we deliver some of our treatments. They're not just apps, they are evidence-based tools that bring structured treatments to patients who need them, wherever they are. Whether it's someone like Mia taking control of her insomnia while managing a busy life, or someone recovering from opioid use disorder with the help of Reset-O, PDTs offer real potential. Yes, there are challenges, like cost and accessibility, but the benefits like accountability, real-time feedback for patients and providers, and extended access to care makes them worth exploring. I'm excited to see where this goes and how it could help patients and providers alike. I hope your brain is full of PDT goodness, no prescription required. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!